Hi, my first interview question is, what motivates you to want to become a nurse? So, about 5 years ago, my husband died of cancer. And throughout the 16 years that I've known him, he'd been in and out of the hospital more times than I can even count. And most of the nurses, the overwhelming majority of them, were just so nice, loving, caring individuals. Unfortunately, on a couple occasions, there were nurses who did not treat him so well, and it was upsetting to him, therefore, it was very upsetting to me. And I've learned to grow from those situations and know that words matter. Our patients realize when we we have a bad attitude towards them, and I don't want to be like that. I want to show the caring, compassionate, be a caring, compassionate nurse, and be there for my patients and their families. The second question is, what do you feel is your biggest area in need of improvement and why? Many nurses during clinical experience said, "Oh, Jennifer, um, we don't just walk on the unit knowing that from nursing school. Things take time." For example, I feel like given that this is a postpartum unit, I want to get to know the medications that are most frequently used on this unit. And I will work hard to understand those medications and their side effects because in nursing school, they just kind of give you a global overview of meds. So I will work hard in doing that. The third question. Think about a time when something went wrong with a patient. What was the situation? What did you do to address it? And what was the outcome? So I had a patient who actually had just arrived on the unit from ICU to this PCU unit. He was recovering from sepsis and he had a trach. And I was in the room standing by the bedside, and my nurse was also in the room, but she had her back turned to us over in the corner and she was typing notes on the computer. And the patient coughed, and I could see that he was in distress, like he could not get the phlegm up. And I said to my nurse, I called over to her, I said, "I think the patient is having a difficult time breathing." And she didn't turn around to look, and she just said, "Oh, he'll be fine." And I said, "No, he looks very distressed." He, at that point, started to grab my arm and shake my arm, and his eyes were real big, like he was terrified. And I looked at the monitor, his heart rate was going up, and then I looked down at his pulse ox, and that was going down. And so I said, "No, I don't think he's okay. His vitals are out of whack now." And so she turned around and she said, "Oh, you're right." And so she said, "Thank you, Jennifer." And so she suctioned him out. And so the outcome was that his vitals returned to more normal levels. So I feel good in that moment that I advocated for my patient. The next question, tell me about a time you had to advocate for a patient that was difficult for you. So I did a day in the NICU. It was a level 2 NICU. And one baby was born at 29 weeks. It was rushed into the NICU there. And they were prepping the baby to be airlifted to the south location because it has a level 3 NICU. So the baby was being intubated, and the nurse there was attempting to start an IV, and I noticed she did not have gloves on. And I thought to myself, this is not right. She's breaking infection control procedures, so I need to do something. So I was a bit nervous, but I knew I had to act. So I just walked over to the wall, grabbed a pair of gloves, and brought them back and just handed them to the nurse. I didn't say anything to her. And it all turned out well. She smiled, she thanked me, and she said, "Yes, I should be wearing gloves." So I didn't know what her reaction was going to be, but I feel good that the baby didn't need to be more sick by getting an infection. It was already dealing with enough. So the fifth question, describe a situation in which you didn't agree with the nurse's decision. How did you address the situation, and what was the outcome? So during a clinical rotation, I had just gotten on the unit, and the call bell was going off. And the nurse said to me, "Oh, that guy again." And I said, "Oh, does he do this a lot?" She said, "Yes, he's a difficult patient, and I don't have time for this." And I said, "Oh, okay, well, I'll go in and I'll check on him." So I went into the patient's room. I sat by his bed and I just talked to him for about 10 minutes. We talked about his hobbies, his family, etc. And I said, "Okay, so what did you need?" And he said, "I just needed my table to be pulled over because it was in the corner and he wanted to use the phone was on the table and he wanted to call his wife because she was very sick, and given that he was in the hospital, he was her main caretaker, so he was worried about her." And so he just profusely thanked me, and I set him up with water, a basin with a washcloth and water and a little bit of soap so we could wash up, his toothbrush, toothpaste. So I set him up. So from that point forward, he actually didn't use the call bell for the rest of the time I was there because he had everything he needed. So the moral of this story is just to, you know, build rapport with your patients, get them everything they need because it will save you time in the end. The last question is, tell me about a specific example when you faced change. What was the situation? What did you do and say, and what was the outcome? So I used to be an exceptional education teacher at Princeton Elementary here in Orlando, and I was a teacher for the moderately mentally handicapped and unit. And so when I first started my first year, I had 12 students, but the next year they rezoned the district. So my classroom was going to shrink my second year of teaching to 3 students. So because they didn't want to let me go, because I didn't have the numbers, they moved me to a classroom with 78 students who were in a pull-out program for learning disabilities. So over the summer, I worked so hard learning all of the children, their individual education plans, and the new curriculums because it was from a K through 5 classroom. So it was very different from what I came from, but I knew I owed it to these kids to give them the best education possible. So I believe that this can translate into nursing because, like I said before, new graduate nurses just don't walk on the floor knowing everything. We have to work really hard at our skills and soak up all the information that we can get. So I feel like an experience like this can translate easily into nursing. Thank you.